segregated. This should be done at one point where waste is generated. Yellow and red coded bins have color coded bags. The bins have the COVID-19 labels. Non-chlorinated plastic bags of not less than 50 microns with biohazard symbols must be used. As a precaution, double-layered bags are used for collection of waste to ensure adequate strength and no leaks. Infectious waste like tissues, cotton, dressings contaminated with blood and body fluids, swabs taken from patients and suspects must be discarded in the yellow bin. Used blood bags must be autoclaved in autoclave-safe bags or microwaves and discarded in the yellow bin. All used masks, including triple-layer masks, N95 mask, head cover cap, shoe cover, disposable linen gown, non-plastic or semi-plastic coverall must be discarded in the yellow bin. All used PPEs such as goggles, face shield, splash-proof apron, plastic coverall, hazmat suit, nitrile gloves into the red bag. Tubings, syringes without needles, catheters and IV bottles and any other recyclable material must be discarded in the red bin. Viral transport media, plastic vials, vacutainers, Eppendorf tubes, plastic cryo vials, pipette tips, used testing kits must be autoclaved in autoclave-safe bags or microwave or chemically treated as per BMWN rules 2016 are collected in red bags. Sharps waste like different types of needles or any metallic sharp waste must be discarded in the white container. Glassware and metallic implants must be discarded in the blue bin. On-site decontamination of waste collected in blue and white containers using 1% sodium hypochlorite is preferred. Collected waste in different bins must be handled systematically. The inner and outer surface of containers, bins or trolleys used for storage of COVID-19 waste should be disinfected using 1% sodium hypochlorite. Collect and store biomedical waste separately prior to handing over the same to CBWTF. Use a dedicated bin labeled COVID-19 waste. Use dedicated trolleys and collection bins in COVID-19 isolation wards with the label COVID-19 waste pasted. Keep the waste separately in temporary storage room or hand it over directly to CBWTF from COVID wards. Management of wastewater from healthcare facilities and isolation wards. Disinfection of treated wastewater to be undertaken as per prevailing practices. Operators of ETPs or STPs to practice basic hygiene and use appropriate PPEs. During COVID-19, HCFs may avoid using treated wastewater. Biomedical waste generated from quarantine centers should be collected separately in yellow-colored bags provided by urban local bodies. Place them in appropriate separate bins. It is preferred the waste be directly transported to CBWTF. CBWTFs must report to the State Pollution Control Board about receiving COVID-19 waste. Operator of CBWTF should ensure regular sanitization of workers involved in handling and collection of biomedical waste. Workers should be provided with adequate PPEs, including the N95 mask, splash-proof aprons, heavy-duty gloves, gumboots, and safety goggles while disposing of the infected waste. A dedicated vehicle must be used to collect COVID-19 waste. It is not necessary to stick a COVID-19 label on such vehicles. Vehicles must be sanitized with sodium hypochlorite after every trip. The operator and the hospitals treating COVID-19 patients must maintain a separate record of the movement of COVID-19 waste. In case there is no access to CBWTF, infectious waste should go into the deep burial pit. All healthcare professionals and workers coming in contact with COVID-19 patients or those handling waste generated during their care must wear PPEs. This is how a PPE should be donned. Remove all jewelry like rings and bangles or any other accessories. Wash hands thoroughly according to the procedure mentioned.
You want this series or what?